Good afternoon, everyone. Thank you for joining us for this Medicare presentation by Avery Hall by way of Alyssa Sinagra. My name is Gigi Lakites. I am a partner and financial advisor with PKS Investment Advisors, an affiliated firm of PKS and Company, the accounting firm. And as a financial advisor, we are often asked about Medicare and navigating Medicare and they, seeking all the guidance and the ins and outs of Medicare really does benefit from working with someone like Alyssa at Avery Hall. Alyssa has been with Avery Hall since 2006, and she is currently the vice president of Avery Hall's benefit solution team. And her specialty is working with individuals and families and helping them find the best plan that fits their medical, dental, vision, life, annuity, and long-term care insurance needs. Alyssa also works closely with Medicare beneficiaries, helping them analyze and choose the best Medicare supplement and Medicare Part D prescription plans. And I can tell you, working with Alyssa in the past with she takes great care in helping clients specifically choose the best plan for themselves, and that's going to work best for them. And her favorite part of her job is to help individuals decide whether they can afford to retire. Their medical insurance plays a crucial role, as you know, in deciding on how to retire and when to retire. And and when a person realizes that they can retire after working their whole life, it is very rewarding for her. So Alyssa, welcome. Thank you so much for doing this for us. And just so everybody knows, before we get started, some housekeeping items. Please use the Q&A feature to post your questions, as we will take questions at the end. And then also this webinar is being recorded and will be shared out later on, but it is being recorded at this time. So thanks, Alyssa.
Thank you, Gigi, and thank you everyone for being on the call today. I really appreciate Gigi inviting me to help hopefully educate a little bit more about Medicare for everyone on this call today. I do try to make it very basic information about Medicare. We really want your private information and HIPAA related stuff to be held accountable between an agent one-on-one versus on this call. And so I just add a little disclosure that if you have any private information about your medical history or prescriptions or income, to not put that in the Q&A, to save that for later. But if you have a question that you think is pretty broad or basic, then please put that in the Q&A so we can help answer those questions at the end. Again, my name is Alyssa Sinagra. Gigi had a wonderful, can't even talk today, sorry. Gigi already introduced me, but I want to introduce a little bit about Avery Hall. Hopefully everyone on the call today has heard of Avery Hall Insurance. Our headquarters is in Salisbury, Maryland. We have 5 or 6 locations now all across Maryland and Delaware. Avery Hall started 100 years ago. We're celebrating our 100th year this year, and it's very exciting to be part of this journey. I've been with Avery Hall for almost 20 years, and I can say that the leaders of this industry and this agency have always put the community first. And I believe that that's why I'm here today doing this education piece on Medicare, is we want to make sure that our clients and that our community is served and educated on the facts of any types of insurance that they have. So we're going to go ahead and jump right into it. Today's objectives, I'm going to hopefully help you understand Medicare a little bit better than what you may already do. I'm going to go over who's eligible for Medicare, the different parts of Medicare, enrollment periods, how to enroll other insurance such as the Medicare supplements and Medigaps, and then finally the Medicare Part D prescription drug plans. First, I try to help people understand Medicare, whether you're turning 65 or over 65. People going on to Medicare a lot of times are frightened or alarmed or seem to have anxiety about Medicare. But I try to tell people that Medicare is exactly what you have now if you're prior to 65. If you're already on Medicare, we'll get into that. But Medicare is a lot like what you had when you had your employer coverage or what you had through the Marketplace or ACA plan, and I'll explain that. So when you go on Medicare, it does consist of 2 parts, Part A and Part B. However, your insurance under your employer plan or under the ACA Marketplace has a network of doctors, so does Medicare. It also requires you to pay coinsurance or copays or deductible, which is typically your responsibility, which is the same under your insurance under your employer or through the ACA marketplace. So I try to tell people it's not much difference than what you have, other than Medicare allows you to buy a secondary insurance that helps you pay those deductibles and copayments, where like your employer insurance or your ACA marketplace coverage does not have secondary insurance. People who are eligible for Medicare are people who are age 65 or older, or who have participated in Social Security retirement or railroad retirement, or whose spouse has. Normally it's around, I believe, 10 years. Others that are eligible for Medicare are those that are under age 65 and have disability for more than 24 months. However, there are certain illnesses or diseases that allow people to get Medicare immediately. Those couple of diseases that are pretty common or more common than others are ALS and end-stage renal disease. So I try to bust out some myths and facts right in the beginning because I want to make sure people know all of these. So the next few slides are strictly what we have heard here at our agency, what the most common myths are. And so one of the most common myths is that Medicare is going to cover all of my medical expenses 100%. As I shared on a previous slide, Medicare has deductibles and co-payments and coinsurance that are typically paid by you as the beneficiary or by your secondary insurance, which is the Medicare supplement. Medicare is free. You do have to pay a monthly premium for Medicare Part B. Medicare Part A is typically free unless you've not been a U.S. citizen in the United States for more than 10 years or your spouse. But Medicare Part B, you do have to pay a premium. And also with Medicare Part B, your premium is based upon your income. So if you have a higher income and they look at 2 years prior to the year that you're enrolling at your income to adjust what your Part B premium is. I do have, I'm sure Gigi has it as well, but I also have a form that can show you what you would pay if you think that your income might be higher. Medicare and Medicaid are the same. Reality is that these two are two totally different programs. They're not interchangeable terms. Medicare is a federal program, which means it goes all across the United States, and Medicaid is a state-run program, and typically is income related for each state, and each state has different income limits. Now you can have Medicare and Medicaid at the same time. That's called dual eligibility when you're on Medicare. I can enroll in Medicare at any time. So this is probably our biggest one, is that people don't enroll in Medicare when they're supposed to, either because they think they're healthy and they don't need it, or they think they can stay on whatever, the ACA marketplace insurance that they might have because they are getting tax subsidies. But the reality is that there are enrollment periods on when you can enroll, which we'll get into later on in the presentation. But if you do have an ACA marketplace plan with a tax subsidy, that does have to end, which we'll talk about that later a little bit. So what are your coverage options? You have basically two coverage options when you plan to go on Medicare. Medicare, the step one is to enroll into original Medicare, which is A and B. And then step two, you have to decide if you need additional coverage. And that's where Avery Hall comes into play, is to help you decide whether you need additional coverage or not. Option one is the most popular option. It allows Medicare to be your primary insurance, which again is a federal program. So your network of doctors is all across the United States. And then option one would allow you to get a Medicare supplement and a Medicare Part D prescription plan. Option two would be a Medicare Advantage plan. These plans are less popular on the Eastern Shore and in Maryland. In Delaware as well. These plans are offered by private companies. They replace Medicare, but you have to continue to pay for Medicare A and B, or just B at least. And they are like traditional like HMOs or PPOs, where you have copays, deductibles, and such under those plans. And you have to follow their network of doctors, not Medicare's network. So it's a much smaller, limited network that you have under Medicare Advantage plans. So the four parts of Medicare, you have Medicare Part A, B, C, and D. They make it simple with the alphabet. Medicare Part A is your hospital insurance. I look at Medicare Part A as anything that is inpatient, requires inpatient care, whether that's skilled nursing care, home health care, or inpatient hospitalization. All the claims will be submitted under Medicare Part A for payment. Then you have Medicare Part B. Medicare Part B is your medical insurance. I call it outpatient insurance, where A is for inpatient coverage, B is for your outpatient coverage, like your doctor's visits, your labs, your x-rays, your emergency room, even though it's in the hospital, it's not inpatient. So this would be submitted under Part B as a claim. It is not a Medigap or Medicare supplement. A and B work together in the hospital and outside the hospital. Part B's annual deductible for 2025 is $257. That deductible does start over and reset every January 1st. And so if you are coming on to Medicare at the end of a year, you have a short period where you have to meet that deductible, or if you didn't go to the doctor, you wouldn't have to meet that deductible. And then as of January 1st, that deductible would start over, and it will likely change after January 1st as well. Most of the time it goes up, as you can imagine. In my 19 years, it's gone down one time. But other than that, it usually goes up around 10 to $20, usually $10 to $20. Medicare supplement plan. So this would be the option one that we talked about, where you would have Medicare A and B with a Medicare supplement plan. This would be a secondary insurance to your Medicare A and B, which is primary. Other terms is Medigap. You may hear that term as well when you're looking at Medicare supplement plans. Medicare supplement plans are also designed by letters, just to confuse you a little bit more. They are A through N, and they skip a few letters in between. However, the most popular plan right now is Plan G and Plan N as in Nancy. And those two plans, coverage-wise, are the same from company to company, but they do vary by premium. But they're standardized. So what that means is Medicare says, okay, Plan G is Plan G, no matter who you buy it from. And so what we do here at the agency is we look for a reliable company that is in the market that we think is going to be a stable, reliable company in the market. We have a lot of companies in the Medicare supplement market that come in and out. So we'll have a carrier that'll come that you've probably never heard of, and they will sell in Maryland for 2 or 3 years and with low premiums, and they'll probably try to grab as much enrollments as they can, and then they leave the market. Your insurance doesn't leave, you can stay, but when an insurance company isn't selling new business, premiums increase. And so we try to rely on stable, reliable companies in this market. As well, we do sometimes have to sell those smaller companies to help people with their premium increases, and that really is important to people to have the premiums lowered. One more last thing, you can change your Medicare supplement at any time throughout the year. There's no enrollment period on when you can change it, but after the first 6 months of turning 65 or enrolling into Medicare Part B, you do have to go through medical underwriting. The state of Maryland also passed a birthday rule 3 years or 2 years ago now, I believe, where you have 30 days around your birthday to make a change to your Medicare supplement without medical underwriting. People typically don't want to change their Medicare supplement because of the coverage or because of the services. It's typically because of the premium increase. Now, if people are okay with the premium increase, you don't have to do anything at all. Your supplement plan will just renew from year to year. Then we go into the Medicare Part C, which is the Medicare Advantage plan. These particular plans, like I mentioned earlier, replace Medicare, but you do still have to pay your Medicare premium. And they're still part of the Medicare program, but they are run by private insurance companies. And so you have to use that private insurance company's network. And those networks, history is typically a lot smaller, narrow network. I would always, if you go this route, I would always recommend that you check your healthcare providers to make sure they take it. One of the simple things I've asked people to do, if this is what you're thinking about doing, is just to simply call the billing department at the hospital and ask them what they think of the Medicare Advantage plan you're thinking of. And that usually helps get you a good idea of what you're getting yourself into. Once you are enrolled in one of these plans, like a Medicare Advantage plan, you are enrolled in it for the year, and you can only make changes during the open enrollment period. We call it the annual enrollment period as well. Medicare Part D is the prescription drug plan. So this would go along with Medicare supplement plans and Medicare Part C plans, because you have to have a prescription plan that joins together. So anyone covered by Medicare A or B can get a prescription drug plan. These plans are also run by Medicare CMS, but they're sold by private insurance companies. So they do typically require a small monthly premium. So right now, the monthly premiums are $0 to $101. I think next year they're going to run from around $4 or $5 to maybe $130. And so there are monthly premiums associated with these. However, each drug plan is different than one another. What makes them different is that each of them have a different list of covered medications. Each of them have different preferred pharmacies, and each of them also have different deductibles and copayments that they have to follow a standard, but typically they either follow the standard or make it better. They can't make it worse than the standard that Medicare has created. The plans and formulary lists do change every single year. So it's really important that you make sure that the plan you have covers your medications, and we'll talk about when you can do that as well. And we help with that. Again, just to wrap up the coverage options you have, your step one is that when you're ready, you enroll into Original Medicare. And then step two, you have either the option of purchasing a Medicare supplement and a Medicare Part D prescription plan, or option two, a Medicare Advantage plan. One last thing about the Medicare Advantage plans, if you ever got into one of those and you wanted to get out of that, you'd have to do it in a time period. But to get back into Original Medicare and a Medicare supplement plan, you're going to have to answer medical questions. So if you're not healthy, you want to think about that avenue as well. How much will Medicare cost? That's typically what everyone's looking for, is how much is it going to cost me? So generally, like we've mentioned, Medicare Part A is covered free for those that have worked less than 10 years. They would have a monthly premium in the United States. Part B in the 2025 is 185. I think it's going to go up to around 206 in 2026. Don't quote me on that though, because Medicare hasn't actually released that yet. That's just the rumor. However, if you're single and your income is more than 106,000 or 212,000, if you're married, you will pay more for your Part B premium. And they look at your tax return from 2 years prior. So in 2025, Medicare, CMS will talk to the IRS. It's nothing you have to do to find out what your 2023 tax return 1040 said, what your earned income was, or annual income, adjusted gross income, sorry. And you can appeal that, though. I do like to make that very clear, because as Gigi is working with people, helping them retire, people's income is no longer what it was. And there's about 8 reasons on why you can appeal that, and work stoppage is one of them. And so if you are in these categories and you are no longer making that kind of money prior, from 2023 or whatever year we're in, then you can appeal that decision. And we have a step-by-step instructions to help you with that as well. So what is not covered by Medicare? So typical things, in my opinion, are not covered by Medicare A and B, like outpatient prescription medications. However, if you are an inpatient in the hospital, your medications are covered under your Medicare Part A. Outpatient prescriptions are covered at a pharmacy, so that's when your Medicare Part D plan will kick in. Another part of prescription medications is if you get injections or shots inside of a doctor's office, that is covered under Medicare Part B. Routine dental and vision is not covered under Medicare. However, there are additional insurances that you can purchase to help you cover dental and vision. Hearing aids are not covered. I want to go right back up to vision really quick. I forgot to mention something. If you have a medical condition with your eyes, such as glaucoma, macular degeneration, or any type of medical condition with your eyes, that is covered under your Medicare Part B under the outpatient services. Hearing aids are not covered under Medicare. However, they could be covered under your employer-sponsored plan or your ACA marketplace plan. So if you're prior to age 65 today, and you're not on Medicare yet, and you think you may need a hearing aids, I would suggest checking the coverage you have to see if it's covered under what you have now, because hearing aids can be pretty expensive. Sometimes they range between $2,000 and $5,000, and I've even heard of some around $7,000. So they can be pretty expensive. Foreign travel is not covered under Medicare. However, some Medicare supplements give you a foreign travel emergency coverage of $50,000. But we do also offer coverage here for medical coverage and trip interruption here at Avery Hall. So if you are traveling outside of the United States, check with us to see, what there may be. It's very affordable to get travel medical insurance. And so I do recommend people look into that. Cosmetic procedures and treatments, I think that's pretty common, that really no coverage for that across the board, whether you're under 65 or over 65 on Medicare or on your employer coverage or ACA. And then long-term care, I want to make sure I define long-term care for you. I should have done that back when we talked about Medicare Part A. So if you remember, Medicare Part A covers skilled nursing facility, and so that's rehabilitation. So Medicare will cover rehabilitation as long as you're getting better. But the moment you stop getting better and you require help with the daily acts of living, that's when long-term care comes in, and typically either you're paying for that. If you have very low income, the state, like Medicaid is paying for that. Or you may have a long-term care insurance policy that will help pay for that. Long-term care insurance can be pretty expensive, but I'm sure Gigi can help with your financial planning to help you figure out how you would pay for that, whether it's insurance or not insurance, because it can get really expensive. How do I enroll? So if you are at age 65, you will automatically be enrolled in Medicare A and B. If you are collecting Social Security benefits, whether you're collecting on yourself or your spouse, you will have an automatic enrollment at age 65. If you're not collecting Social Security, then you have to manually enroll. You go through the Social Security website or you call your local Social Security office. When can you enroll? So there are different enrollment periods: annual enrollment period, the initial enrollment period, and special enrollment period. The annual enrollment period is what we're getting ready to go into. It is from October 15th through December 7th. So these are for people who are already enrolled in Medicare. This is the time period that they can make changes to their Medicare Part D prescription plan if they want to make changes or think that they need to make changes. You don't have to make changes. Your plan that you have will renew from year to year. But if there are significant changes within the plan you had into the 2026, and that would be why you would want to reach out to see if there's a better plan that might suit your needs a little bit better. The initial enrollment period, that is when you first become eligible for Medicare at age 65 or disability. You can enroll into Medicare 3 months prior to your birth month, and then the month of your birth, and then 3 months after. However, coverage will be delayed during the month of your birth and the 3 months after. Typically, it's only delayed 1 month. Special enrollment period. So the special enrollment period is used for people who are staying employed or staying on their spouse's employer health insurance plan. When you do decide to retire or your spouse decides to retire, you can use a special enrollment period to enroll into Medicare. And it follows the same type of enrollment periods where you can enroll 3 months prior to the effective date you want. But we will help guide you through all of that, including like step-by-step instructions on how to apply. During the special enrollment period, your employer or your spouse's employer would fill out a form that would help waive any penalties that you may have heard about. So you want to make sure that no penalties are there. So you want to make sure your employer fills out that form. Then there's the general enrollment period. General enrollment period is for people who just totally forget that they had to enroll into Medicare for one reason or next. And if you miss this total 7-month window, then you fall into the general enrollment period where you can only enroll January through March. The effective date is the month after you enroll. However, Medicare does charge you a 10% penalty for every 12 months you go without having employer-sponsored coverage or Medicare after age 65 when you become eligible. Do I have to enroll into Medicare? Technically, there's nothing that makes you enroll into Medicare. However, there are penalties if you do not enroll into Medicare. So I say yes, if you do not have an employer-sponsored health insurance or your spouse does not have an employer-sponsored health insurance, you should enroll into Medicare. I also tell people that if you do plan on working or your spouse is continuing to work, know what your options are at age 65, because it could be that it might be a little bit cheaper or lesser deductibles on Medicare. And just knowing what your options are, and Gigi could probably attest to this, that a lot of people work for healthcare, for health insurance. And knowing what those options are make that anxiety or stress go down just a little bit when the time comes. Or you might decide to retire early. That's like Gigi's mentioned, that's one of my favorite parts about my job, is when I can help someone realize that they can retire, because that's what we've worked for our entire lives. Yes, we work to live, but we also hopefully have worked to retire. And so when I can help someone decide and realize that, hey, I don't have to work 5 more years to afford my health insurance, and Gigi can help with that as well. It's really enlightening for our office. And then if you do have employer-sponsored health insurance or your spouse does, you don't have to enroll into Medicare. But like I said, it is good to just know what your options are at that time, just so you have an understanding of everything to do. And what to expect. If you're on Medicare right now, you're going to be bombarded with mail. You're going to be bombarded on the TV. Like it's just right now, everybody's going to be talking about open enrollment and making changes. I had a call today. There's a lot of tricks out there. So I try to warn people about these tactics and tricks. I had a phone call today. It's a voicemail that I haven't returned yet, but I'll get there. But I had a call today from a client who called and said, "Hey, Alyssa, I got something in the mail that says I'm eligible for a grocery card. I'm eligible for more benefits in my Social Security. I'm eligible for, I don't know, $100 towards my prescriptions." I filled it out and they wrote me back and said that I am eligible, that I qualify for it. And that's actually a Medicare Advantage plan. And so that is a tactic that some agent or some company around the world or around the United States is using to get people to call them and to try to sway them into enrolling into this Medicare Advantage for a free grocery card. It's pretty awful. It's pretty sad. I don't, you shouldn't change your health insurance to get a grocery card. Health insurance is very important. It can really impact your financial situation. And so it's really important that I tell people, anybody I do this webinar or seminar for, I tell them, don't fill anything out, because what you're doing is you're opening up those floodgates for people to reach out to you. A lot of times the things that come in the mail that look legit, like postcards, you fill that out and they're selling that information to agents all across the United States. And that's how the phone calls start. You really don't have to start preparing until about 3 months before your 65th birthday or 3 months before the effective date you require. And best of all, Avery Hall's services are free. The companies that we sell insurance for, like the Medicare supplements, they pay us a commission to service you. We're not just salespeople. We look at ourselves as educators and help you through the entire process. And we have an entire service team under my leadership that helps you once we've sold the product. That way, whenever you have a question or problem, you start with us. You can call or text us at 410-742-5111, or you can email us at medicare@averyhall.com. And
Hey, Alyssa. So
yeah.
thank you so much. And I can attest again, she is very helpful and will answer all of your questions without any strings attached. So here we do have some questions.
Okay.
So, and I think you might have answered a couple, but let's just go through them again. Is the employer-sponsored coverage exemption limited to employers of a certain size? I thought it had to be an employer of over 25 employees.
So it gets really confusing when you read that rule. It's 20 employees, whether Medicare is primary or not primary. But typically what I recommend to people is that if you is when you're eligible for Medicare, go to your HR, your benefits administrator through your employer, and ask them if you have to enroll into Medicare. Normally you don't have to, but there are particular plans that require you to, which that's when that rule comes into play about the 20 employees and if Medicare's primary or not primary.
Right. Okay. If you didn't register for Medicare ever and are above age 65, are there any penalties, which I think you did?
Yeah, if you have employer-sponsored coverage, the penalties can be waived by your employer filling out a form, a Social Security form. I think it's the LM. I have it in my email, but there's a form that you can avoid those penalties. But if you have absolutely no coverage, then there are penalties, and the penalties is 10% for every 12 months.
When does that form need to be submitted? Is that when somebody is eligible?
You have 8 months to enroll. I think you have 8 months. Once you lose employer-sponsored coverage, you have 8 months to enroll into Medicare. And so in those 8 months, you can submit that form. But I typically have people submit it right when they're enrolling, all at the same time.
Okay. So here's another question. I'm not happy with my supplement. Do I have to wait until the enrollment period to change?
No, you don't have to. So with the Medicare supplement plans, you can change at any time throughout the year. You do have to answer medical underwriting questions, and they're really looking at major medical issues, not minor medical issues. However, if you're ongoing with any medical issues, it's possible that it wouldn't go through. However, if you're in the state of Maryland, there is a 30-day window where you can enroll without medical questions. So typically what we recommend is let's try to do medical underwriting. And then if not, we will advise you to wait till your birthday if you're in the state of Maryland.
Okay, awesome.
Any other questions?
I don't see any other questions. Thank you again, Alyssa.
Yes, thank
Please
you,
reach
Gigi.
out to her. If anybody needs her contact information, you can reach out to PKS. You can reach out to me at Gigi@PKS, and I can supply that if you don't have it. But thanks again. Always full of knowledge, and I appreciate it. Thank you.
Happy to be here. Thank you guys. Have a great day.
You too.